Good morning, ladies and gentlemen. My name is Deb Uber, the Education Coordinator for the Embryo Adoption Awareness Center, and we are excited to have you all here this morning and are very pleased to bring you the webinar entitled Acupuncture and FET, Holistic Options to Increase Your Transfer Success Results. Before we get started, I want to do a little bit of housekeeping. And during the presentations, all participants will be in a listen-only mode. There will be a question and answer session at the end of the presentation using the questions you submit through the Q&A feature. You may submit your questions at any time during the session, and we will answer as many as possible at the end of the presentation. To ask a question, simply click on the Q&A panel in the lower right-hand portion of the screen, type your question into the dialog box, and click the send button. If you happen to be in a full screen view, you can click on the question mark icon on the toolbar in the lower right-hand corner of the screen. This will open the Q&A panel on your screen only. When you submit your question, it will only be visible to all of the panelists, but not visible to the other attendees. We expect this presentation to last approximately 30 minutes with some extra time for questions. We will be distributing a copy of today's presentation and a comprehensive list of all answers to any questions submitted today during the webinar. If you experience any technical difficulties during the presentation, please contact WebEx Technical Support at 866-229-3239. And just as a reminder, this presentation is being recorded today. So let me switch it over. This morning we have Dr. Rita Stanford joining us to share about holistic options that can increase your patient's chance of having a successful frozen embryo transfer and a healthy pregnancy. Dr. Rita works with both acupuncture and oriental medicine and is licensed as an acupuncturist in the state of Colorado. She is a diplomate of acupuncture and Chinese herbal medicine. Dr. Rita also has certification in TCM, gynecology, and obstetrics. She has studied in China twice, including a gynecology internship in the Hunan College of Traditional Chinese Medicine. Dr. Rita has been in practice since 1994 and has been certified in NAET and Biosat allergy elimination since 1999. She has a practice located in Boulder, Colorado, and has experience working with clinics to help treat patients undergoing IVF and who have also had recurrent miscarriage syndrome. So Dr. Rita, we're really happy to have you today, and I'm going to go ahead and hand over the presentation to you.
Good morning. Hi, this is Dr. Rita Stanford. Welcome to all the doctors, nurses, and patients, prospective patients. I'm going to talk to you first about what traditional Chinese medicine is. The acronym we use for it is TCM, and it's a form of medicine developed in China between 2,000 and 3,000 years ago. It incorporates acupuncture, herbal medicine, which they call internal medicine in China, Tuina, which is a remedial massage, Qigong, which is a form of exercise, and dietary therapy. TCM holds that Qi, or vital energy, circulates through the channels called meridians. Acupuncture seeks to supplement Qi, or in some cases sedate it. It is the deficiency of Qi in blood, or the blockage of Qi in blood, that causes disease. So today we're here to talk about the prevalence of recurrent miscarriage syndrome, which affects more than 5,000 American women annually. 7% of recurrent miscarriage syndrome is due to chromosomal defects. 10% are due to anatomic abnormalities, and 15% are due to endocrine or hormonal abnormalities. 6% of recurrent miscarriages cannot be explained, and a very high number, 55 to 62% of cases, are due to blood coagulation, protein and platelet defects. How can acupuncture help with recurrent miscarriage syndrome, IVF, and EFT? Patients receiving acupuncture-assisted IVF were tested with a control group and found to be 42.5% more likely to become pregnant with acupuncture treatments done before and after EFT. And it was very helpful with implantation, and you can see the study up there in the corner that you can look on PubMed also to see it. And so it has been very helpful with implantation. And I have had some experience myself with that, where I had a doctor come from Montrose, Colorado, who had IVF in Aurora, And the acupuncture treatment is supposed to be done right after the IVF treatment, and so she came to me on her way back to Montrose, and it was a successful implantation. So it is very helpful, and a lot of infertility clinics use acupuncture right after and before, and now it's commonly used with EFT. So the other thing to look at is how can acupuncture help maintain a healthy pregnancy and prevent a miscarriage. So one of the things that we look at is the fact that women give enormous amounts of blood and chi, which is energy, to the fetus or embryo during the pregnancy. And some people go into that process deficient in chi and blood. So we're able to help them with the acupuncture and in some cases herbal medicine to help them supplement these issues. So also during the pregnancy, women can have a number of different issues that come up that due to stress or just the pregnancy itself. They can have morning sickness, edema, bloating, sleep disturbances, anxiety, emotional problems. And with acupuncture and herbal medicine, we're able to alleviate that stress for them, so making the pregnancy a much more enjoyable experience. So the other thing I want to talk about today is something that I've been trained in for about 16 years, and it's called Bioset Allergy Elimination. And it's a very helpful system to help allergies that can cause miscarriage and infertility. Bioset Allergy Elimination and Desensitization is a system of allergy elimination and desensitization originated by Dr. Ellen Cutler. She is both a chiropractor and a medical doctor. The acronym Bioset stands for Bioenergetic Sensitivity and Enzyme Therapy. When dealing with hormonal imbalances, Bioset can be very helpful with women, especially I understand that with EFT and also with IVF, a lot of hormones are used to help with the process of pregnancy, of becoming pregnant. So and some of these hormones can cause women some discomfort. And what we do with the Bioset system is treat those hormones so that the patient can do better during that process of becoming pregnant. So we wind up balancing the hormones. So how is this done, you ask? Allergies or poor metabolism of a substance are determined either through the use of computerized testing or through muscle response testing known as MRT. It's also called applied kinesiology, and that was developed by a chiropractor back in the 60s named George Goodhart. And he found that when he tested meridians and they showed weak, he was able to have a patient hold a supplement and the meridians then tested stronger. So from that, he developed applied kinesiology, and it's been practiced since the 60s. So the other thing that patients do to help their acupuncturist know how to help them is they bring in diagnostic tests, such as blood work and ultrasounds from their physician. And that helps us be able to focus their treatment in the right direction. So how we do this allergy elimination is we take the allergen, and it can be a food in the case of celiac disease with gluten, or it could be a vitamin or a protein, and we take that and we actually use vials of the substances that are made from computers. So the vial has the electromagnetic energy of that substance, and the patient touches it, holds it in their hand, while receiving an acupuncture or acupressure treatment. And we balance their organs using the acupuncture and help their symptoms. And 24 hours after that treatment, the patient is said to be able to metabolize that substance. And I know that sounds pretty crazy, but it really does work, and we have tests to prove it. So some of the allergies that can cause malabsorption that lead to miscarriages or sometimes infertility is luteal phase defect, or LPD. And this occurs when the luteal phase is shorter than normal, or progesterone levels during the luteal phase are below normal, and sometimes both of these things occur. The other issue that can come up with miscarriage and infertility is celiac disease. Evidence suggests that women who have celiac disease are far more likely to experience pregnancy loss than women who are not allergic. Another issue is a thrombotic problem called antithrombin 3 gene deficiency. This can lead to stillbirths due to clotting of the placenta and eventual death of the fetus. And there are other thrombotic diseases that lead to these problems, such as MTHFR. So how does one treat this problem, luteal phase defect? So LPD is believed to interfere with the implantation of the embryo. If progesterone levels do not rise at a certain point during the pregnancy, a miscarriage may result. Luteal phase defect has been linked to many health conditions, including anorexia, endometriosis, extreme amounts of exercise, hyperprolactinemia, obesity, polycystic ovarian syndrome, and thyroid disorders. Celiac disease is an autoimmune disease that can occur in genetically predisposed patients where the ingestion of gluten leads to the damage of the small intestine. A woman who has celiac disease or gluten intolerance is far more likely to have trouble during pregnancy, and the incidence of miscarriage for these particular people are 9 times the normal rate. Some of the symptoms of celiac disease, and by the way, you don't have to have celiac disease to have the following symptoms, because a lot of people with malabsorption or food allergies have these same issues. There are digestive problems, including abdominal bloating, pain, gas, diarrhea, pale stools, weight loss, severe rashes, iron-deficient anemia, musculoskeletal problems such as muscle cramps and joint and bone pain, growth problems and failure to thrive in children, and I have treated those kind of children that throw up all the time, seizures, tingling, sensations in the leg caused by nerve damage and low calcium, sores in the mouth, and missed menstrual periods. So how does one treat celiac disease if one is a bioset practitioner? What we actually do is we find out what all the allergies are through muscle testing. So we put the vial in the patient's hand, and if the arm weakens, then we know they're either allergic or malabsorbing that substance. And then the patient touches the vial while receiving the acupuncture, and that balances that electromagnetic energy that they're encountering in that process. So other health problems that can result from celiac disease or even other food allergies or malabsorption is osteoporosis, as we've mentioned, miscarriage and infertility, birth defects such as neural tube defect when the person isn't absorbing folic acid, and that's very common, seizures, growth problems in children, and cancer in the intestines, which seems to be rare. Another issue that I have dealt with personally and professionally is women who have antithrombin 3 gene deficiency. What this means is instead of 2 genes, they have 1. So their blood has a tendency to clot. They may experience miscarriage, and that can be a problem for maintaining the pregnancy, as the placenta will clot off and the baby's not receiving any nutrition. So antithrombin 3 is made up of proteins, and patients can be treated specifically for proteins and protein metabolism, which enables them to produce another antithrombin 3 gene. It has been shown that changing one's diet can actually assist in this process. And I want to refer right now to people say, well, how can you change someone's genes? Well, you know, epigenetics has shown us a lot of cases and studies where this can happen. I want to point out to one in the year 2000 where a professor at Duke University. He was an oncology, radiology professor. Randy Jurdy and his postdoctoral student, Robert Waterland, designed a groundbreaking study where they studied the agouti mice. And they had that particular agouti gene, which made them yellow in color, and they had a ravenous appetite and were prone to cancer and diabetes. So Jurty and his postdoctoral student decided that they were going to try to turn off the agouti gene, and they did that specifically by changing their diet. They fed them things that gave them methyl donors, such as onions, garlics, beet, and B vitamins, especially folic acid and B12. And they did this before conception. And what happened was the offspring turned out to be a mousy color. They were not ravenous, and they led longer lives, and they did not have cancer and diabetes. And what they found from that study was they were able to turn off that gene. So in this case, with antithrombin 3 gene deficiency, we were turning the gene on. So a patient's pregnancy can be threatened when they have luteal phase defect, antithrombin 3 gene deficiency, and celiac disease. The Bioset system allows the patient to have a more secure pregnancy, and I have actually worked with a patient who had 2 of these syndromes. So my patient, her fertility doctors weren't able to ameliorate her luteal phase defect and her antithrombin 3 gene deficiency, even though they were giving her 17-OH progesterone and heparin. She was a 33-year-old patient when she came to me in 2002, and she had a history of repeated miscarriage. At this point, she had 4 miscarriages, even seeing fertility doctors. She had weight gain, PMS, circulation problems, feeling cold. She had food and environmental allergies, and she was diagnosed with both luteal phase defect and antithrombin 3 gene deficiency. Despite taking the progesterone and the heparin for these 2 conditions, she had 4 miscarriages. And she was told by her infertility specialist that she would not be able to have a child and she would be prone to blood clotting disorders. The progesterone level would not rise at week 10 of her pregnancy, and she would have a miscarriage. Without resolving these 2 things, she would eventually miscarry again. So I had this patient come in on a Friday, and she basically had almost a nervous breakdown with me because she'd had 4 miscarriages. And she said to me, "My doctor says I can't have a baby, but I think you're the one that's going to help me." So I actually went home this particular weekend, and I prayed about it, and I thought, I've treated her for progesterone, and it still hasn't made any difference. So I decided that I would treat her for cholesterol when I saw her on that Monday, because she was now pregnant again, and that next week was week 10 when she had to go up on her progesterone. So, and hers would stay about 9 or 10 nanomoles, and we needed to get it up to 20 or 25. So on that Monday, I actually treated her for cholesterol, and 3 days later, her progesterone went up. And she does have now a 12-year-old little girl. So that was a very successful story. So after treating her for the progesterone through cholesterol metabolism and allergies, she was able to carry this pregnancy to term. And blood tests that we did later on demonstrated that she no longer had the luteal phase defect nor the antithrombin 3 gene deficiency. So that was pretty much an amazing experience for me, and I'd like to have more of them, but in my doctoral program, I tried to postulate putting forth a study for women with clotting disorders, and unfortunately, I'm not a researcher, so I don't get to do that, but I would love to do that someday. But anyway, so that was one of the most successful experiences I've had, and this girl is thriving and very healthy. So that's how allergy elimination can resolve some of these pregnancy issues and infertility and recurrent miscarriage problems. So a lot of people wonder what acupuncture feels like, and they worry about it's going to be painful because they think of the size of the hypodermic needle. And as you can see here in this picture, they're very thin needles, and they're more like pins than needles. For the most part, they don't hurt. They're very high-quality needles. They're Japanese needles, which are the best on the market, and they're very less painful than the Chinese needles. If a patient feels anything at all, if it feels like a mosquito bite, it tends to relax you, also can give you energy, lessens anxiety, helps sleep and digestion, and promotes circulation to ensure that the baby stays secure. So if you're interested in finding an acupuncturist, there are many associations. First one listed here is Acufinder.com. There's local acupuncture associations. I'm a member of the Colorado Acupuncture Association. And then in terms of the allergy elimination, the original one was called Nambutrapod's Allergy Elimination Technique. You can see it here, NAET.com. And TheramedicsBioset.net, which is what I do. And then our governing body for the entire country, where you have to be licensed through, the National Commission for the Certification of Acupuncture and Oriental Medicine. Also have lists of acupuncturists in your area. So now we're going to open it up to questions.
Thank you, Dr. Rita. That's just great. I loved hearing you talk about all of that. So I'm going to open it up for questions. It looks like we already had one come in, but if you had any other further questions, you can be entering that in at that time. And while you are entering your questions in, I'm going to introduce a couple future events that we have. Next week, we will be sharing a webinar. It's an evening webinar on personal stories, snowflakes beating the odds. And so that's with families that have gone through the Snowflakes Embryo adoption program and just sharing their experience with adopting 2PN or day 3 embryos. You know that with a lot of clinics, it's more popular to receive the blastocysts, the day 5 blastocyst embryos. And so we just wanted to share some of the experiences with families in adopting different qualities, and it's going to be a really great webinar. So then the next month we are going to have a re-showing of Grieving the Loss of a Genetic Child. It was really popular last time that we showed it, and so that is just going to have a focus on the emotional impact that infertility can have and how patients and families can kind of grieve through that process so they can consider other options for parenthood, whether that's going through IVF, using an egg donor, sperm donor, or embryo donor. And so that's going to be another great webinar that we would be happy to have you guys come to. And then we also have our latest educational tool, Pathway to Family. You can actually follow that link to be able to go check out that magazine. And so I'm going to go ahead and open it up for questions because I know that we have not as much time left for you guys, and I know you have busy days. So the first question that we had that came in is, what kind of diagnostic tests specifically can I bring to an acupuncturist?
Well, I mean, it depends on what your diagnosis is, of course, and in case of this particular woman that I mentioned who had the luteal phase defect that was shown in blood work, and also the antithrombin 3 gene deficiency was shown. But some people will bring ultrasounds, CAT scans, and I'm not saying that I am in any way efficient at analyzing them, but it helps me, you know, by reading the report, know exactly what direction. And sometimes people don't have any idea why it's not happening, and we're able to figure out here, are they malabsorbing something? Is there a blockage in the fallopian tubes? You know, so those are the kinds of things based on their symptoms and how we view traditional Chinese medicine. We try to balance everything, and the acupuncture itself can sometimes just help people get pregnant, you know, just because it has this ability to open up things that are blocked. You know, in the cases of fallopian tubes that are blocked, sometimes they do tests where they can show in ultrasounds that that's the case, and then we can prescribe herbs to open up that area and also the acupuncture. So it depends on the diagnosis of the patient if they have one. So.
Right. Okay, and then we have another question that came in. We have somebody who has had 4 miscarriages, and they've been told by a fertility specialist that everything is what it should be. She's 40 and she has 3 children, and her last child is deaf, and that runs in the family for her. She asked, if everything is fine, can acupuncture help?
Certainly, again, we would have to come up with her diagnosis to understand what the issue is, And, I don't know if the husband's been tested to see if there's any problem with the sperm, the motility of the sperm, but you'd want to look at that too. I'm sure you have. But at any rate, we certainly would, what we do basically is take all the symptoms and we make what's called a pattern diagnosis. And based on that, we can prescribe herbs and acupuncture to find out what the reason is the person isn't getting pregnant. And sometimes it's, I'm not saying it's 100% successful, but it can be successful. So it just depends on each individual's syndrome and how much they'll be compliant in following our directions in terms of taking herbs and receiving the acupuncture.
Okay, we got some more questions coming in. How often do women seek alternative medical treatments for infertility? In other words, what percentage of the 500,000 women you refer to seek the types of treatments that you have discussed?
Well, that's a good question. I don't have a specific answer for that, but, since in the last 20 or 30 years, there's more people seeking alternative medicine than there is Western medicine. I'm sure initially they go, when they're not getting pregnant, to fertility specialists and to their gynecologist and obstetric doctor to discuss their options and what the issues are. And based on that, we do see a lot of people, and, because I specialize in allergies, people don't necessarily see infertility in the form of malabsorption or allergies. So I may not be attracting those kind of patients, but, usually what happens is people come because they have allergies, and then in the process they want to get pregnant, and then we work on it. So I don't have a specific number, but I would say it's at least 10 to 20% of those people will be seeking it. But like I said, it's just not very well known that it's helpful for that.
Right.
Because I have a certain specialty that I attract patients from,
Okay. Are only women treated through acupuncture for fertility issues, or can acupuncture also help men who are part of a couple struggling with fertility?
Absolutely. Men are often, we don't see as many men because they don't think of it that way, but I have a particular patient that comes to mind right now, and he's probably in his late 50s, and many of his friends are having problems with impotence and performance issues, and he claims, and his wife has actually told me this, who's also a patient of mine, that he believes that the reason he's able to still perform in that way is that because of his acupuncture and the fact that he's gone for years. So yes, men can also be helped.
Yeah, absolutely. Okay, and then we have
I have one other patient, if I could mention one other patient.
Yeah, go ahead.
I'm thinking of right now. I saw him years ago. He had all kinds of sinus allergies, and at night he was unable to. He actually called me up and told me, he says, "You're the reason that my wife is pregnant," which I found very funny for him to say, because at night he would be so uncomfortable just with his own allergies of blowing his nose and not being able to sleep. And he was able to, get, so some of the conditions and symptoms that people have can prevent them from, it may not just be infertility, it may be that I feel lousy, and I'm not interested in sex. But
right.
So that is another person I can think of in my own personal, patients here.
Right. So then we have another question. What is the actual evidence on acupuncture and IVF success? And I know that we will be sending this study that we found that had the 42.5% increase, and so I have a link to that I'll be sending in the follow-up email, but if you have anything to add to that.
Right. I think you also have that on the slide where we mentioned it. Remember, it was up in the top-hand corner.
Yeah.
There's a PubMed reference and the actual reference to it.
Yeah, so I'll be sending that out, plus you'll get copies of the slides, too, so if you want to review that, that's fine. And then I have one final question. Is there something specific I should look for when finding an acupuncturist? What about the spiritual component? I'm new to acupuncture, so I'm unsure what to look for.
So one of the things I would be interested in is, first of all, what are your symptoms and what experience the acupuncturist has with that. And I probably would look for someone who has at least 3 years experience. And there's different levels of acupuncturists. Nowadays, you don't have to necessarily do herbal medicine. In China, of course, they have 2 different kinds of doctors. They have the internal medicine doctor who just writes formulas all day of herbal formulas. And then you have an acupuncturist. And in China, what they do is they take the cream of the crop to be able to do internal medicine, which is writing the formulas. And when I was in China the last time in 1997, when I did my gynecological and obstetrics study with 2 very famous gynecologists over there, they wrote formulas all day. And they actually, believe it or not, did pelvic exams, and they actually did minor surgeries. And so they've incorporated both Western medicine and Chinese medicine into their process there. Of course, they also have separate hospitals where they do Western or biomedicine. And so here I would look for someone who actually does do herbal medicine and has the kind of experience at what your symptoms are, whether it's miscarriage or, recurrent miscarriage or infertility, or whatever your particular situation. I'd want to know what kind of experience that person had, and also, if you're interested in allergy elimination, how long they've been doing that and where they've been certified, and those are the kind of questions that I would ask.
Yeah, and I'll go back to on the slide. You will receive the follow-up for this, but I believe you can actually select specific focuses when you're on the acufinder.com. I think that's how, when I've looked through it, you can actually say, okay, if there's a success specifically for infertility, you can include that in your search. So that helps to narrow it down a little bit. Okay, I don't see any other questions going in. We're about 5 minutes after our 30-minute kind of time frame. So I'm going to go ahead and close it up. I wanted to thank everybody for joining us today, and thank you, Dr. Rita, for joining us for the webinar. It was really great, and I just hope you guys all have, I hope you all have a good day. Thank you.